Hi, welcome back to the Talking Horse podcast. We are here with another episode with another guest, and we're again the three hosts today. I'm Cora, I'm 20, I'm from Germany, and I love dogs. And who are you?
Hi, my name is Nolan. I'm from Mexico and I love cats.
Really?
Yeah, cats are better.
Oh, my heart.
I'm Eli. I'm 19 years old and I'm also from Mexico.
Okay, so hello everyone, I'm Jorge Pastrana. I am an international medical graduate and I am 26 years old. So I feel like older in front of you guys.
Well,
And I really like playing video games.
okay.
Yes.
What video game do you like?
I really like The Last of Us. It's for PlayStation and now it's for PC as well.
Yeah.
But first it was an exclusive game and I really like the story.
There's also a series of
Yes.
Have you seen it?
Yes, of
You're
course.
watching it?
Yes,
It's
I'm watching.
great.
I'm waiting for Sundays because Sundays launch a new episode.
You're looking forward
Awesome.
to it, right?
Yes, I think that this Sunday is the third episode of the
Yeah.
Last of Us series, part 2. You should know. You need to watch it. This
And episode, I'm looking forward that they make a funeral for Joel.
Yes.
Yeah.
I mean, I don't know anything about the show or the video game. I don't even know what it is about, but I think there was a spoiler.
Yeah, no, you know.
Kind of it. It's a little one. It's just a little spoon.
Yeah, to be fair, last time when we were talking about the books, I spoiled the entire book that I was talking about as well.
Yeah.
Fair enough. Okay,
Great game.
but video games, cats, and dogs are not the reason why we have you on our podcast today. We have you on because I met you during your preparation for a specific interview, right?
Yes.
Where we practiced an interview in English. Because what were you doing?
Yes, it was a very a nice story. It's a very nice story of how we meet us. Because I was preparing some exams for my specialty, and I went to the library to hear in engineering library, and I met Cora because I saw she was talking in English in a very good pronunciation, and because I was this interview for a scholarship, a specific scholarship, I approached her. And I asked you if you could help me with my pronunciation and some kind of like preparing this interview. So this was our story.
Exactly, because Jorge is a doctor. And you were applying for what program or what scholarship were you applying for?
Yes, I am interested for a scholarship for a master degree since I finished my MD in 2023. Guys, medicine is a really hard degree. Yes, and it was like 7 years, and I finished. I start in 2017, and I finished in 2023. And then I realized that I want to continue growing in my academic path, and I want to apply for United States, my specialty. But you need to do a lot of things: research, connection, networking, letters of recommendation. And one way to do all of this stuff is to apply for a postgraduate program, for example, a master degree. So this is why I'm interested in pursuing a master degree, because by applying to this master, I can get all the stuff: research, connections, networking. Obviously, in the United States, the master degree. So
exactly.
this is the kind of scholarship that I have applied, and now I am waiting for my results.
Okay, yeah. Good luck to you in that way. What I found very impressive also is what school exactly you are applying to, because it is which one?
Yes, I have like this dream to enter and get accepted by Harvard. So I am planning to apply to Harvard. I know that Harvard is a very friendly with internationals, And also I have been in contact, in touch with the university, because last year I took a course. It's called the Principles and Practice of Clinical Research, and it was a 9 month course, live online. I need to take classes every week for 9 months. I have to do assignment, exams. It was a hard course, but I learned a lot. And this will open me this door to apply for the master. So I hope that I can apply and get accepted.
That's amazing. I love
Yes.
I love your goals.
Yeah.
Do you guys have a specific question that you want to ask right now?
So I need to ask you,
Okay.
which specialty are you looking for?
Okay, nice question. I really like general surgery, and I am applying for general surgery. And because this is a chirurgical specialty, so you need to do surgeries. It's very difficult. It's very difficult for
Because you need to learn everything, like the stomach, the brain.
Yes, and because it's very well paid. A lot of people
It's one of
want
the
to.
best paid.
Yes.
General.
Yes.
So a lot of competition.
A lot of competition,
Yeah.
not only with the Americans, but also with the international medical graduate. And I am an international medical graduate because I did not do my studies in the United States. So everyone who's finished the MD outside the United States are an international medical graduate, and there are a lot of competitions. For example, in India, when they enter to the medical school, they know that they are going to apply for United States, so they are preparing whenever they start. So I am applying for general surgery, and there is a lot of competition, so I need to push myself a lot to achieve this.
I'm asking you this because, well, my father is also a medic,
Okay.
but, well, he's gynecologist,
Okay, perfect.
but he's also a gynecologist surgeon.
Yes.
So I'm kind of like in this stuff.
Okay.
But when I was younger, I expected for me, like, well, of course, he also expected for me to study
Medicine.
medicine because I think it's general in the medic parents, no? That like they expect their sons to study also medical stuff and all that.
Yes, it's difficult. For example, my father is also a physician, but he is a general physician.
As he wanted you to study physics, right? Or
Sorry?
he wanted you to study physics.
No, a physician is a doctor.
Okay.
A physician is a doctor, yes. So my father is a general physician. It's like me, an MD. He has an MD, but he cannot continue this pathway of the specialty, so he stayed with an MD only. And yes, there are a lot of pressure whenever one of your families is a physician, because it's like this. Oh, I am a physician. You need to. Well, they didn't tell you as you need to be a physician.
But you feel that pressure.
Yes. But in my case, it didn't occur like that. I choose my own path, and I decided I want to be a physician by my way, by my own.
Yeah, that's maybe. Why? I mean, in my case, I decided not to study medicine because, well, I kind of hate that pressure from my, well, not at all for my family, but for the partners of my father. Like, you need to be as good as your father is, and there was so much pressure around. So that's why, well, I was a religious kid. So I was like, no, I don't want to study medicine anymore. I want to study music.
Oh.
And I think I was kind of a good musician, maybe. I don't
What
know.
instrument did you play?
Guitar, bass, keyboard, and the drums.
A lot? Oh.
Yeah.
Yes, a lot of.
Yeah, I had so
instruments.
much free time doing that. With the days.
You will be a very good musician, I think.
You'll never know.
Studying engineering. Computer engineering?
Computer.
Yeah,
Yeah.
right now.
As well.
But I think that this is a very I think that you can practice the music and as a hobby. So, for example, I am a physician, but also I do a lot of things. For example, I like sports and I practice. I have practiced karate-do. I have practiced football and natation for almost 10 years.
Same, right?
So from what age on?
I started to sports when I was almost 7 years. And
So like six,
7
years old. Okay.
and I left when I started medicine, in 17 years old. So I practiced 10 years sports. And if, for example, in karate, I have the opportunity to travel to here in Mexico to other places like Monterrey, San Luis Potosí, Guadalajara, and Morelia, and internationally. Only one time, and it was Japan in 2013 when I was 14 years old, guys. When I was 14 years old, I had my first international travel.
Cool.
I was very scared, and I remember that I was crying, and I told my mom that.
Yeah, I mean, you were far from home.
Yes. And I'm very scared about I'm going to fight with a Japanese or a Chinese, and they are going to
eliminate you.
They are going to hit me very hard. Yes, I was very scared, but it was an amazing experience. I was 30 days in Japan.
Wow, a month.
A month.
For all of the people who don't know math, like me.
And the competition was only 3 days, so the rest was for
just
knowing
fun.
the places and
Tourism.
Yes,
That's so
tourism.
cool.
Yes.
Wow.
Yes.
That's honestly also just incredibly impressive that someone with you're applying to Harvard Medical School at this moment, but you were also an international athlete when you were younger. I find your resume incredibly impressive, really.
Thank you very much, Cora.
And why did you decide to stop? How do you say? To stop doing karate?
Okay, to stop practicing karate because I moved to a different city. So I studied medicine in Mexico City. I was born here in Toluca. I finished my basic elementary school and my
the high school, right?
yes, the high school here in Mexico in Prepa 1 de aquí de la UAEMéx.
And then you moved to Mexico City.
Yes, and then I moved to Mexico City. So I need to change a lot of things. My friends, my sports. It was like a moment of adaptation for me.
Like getting out of your comfort zone.
Yes, but I think that this experience showed me a lot of things that if I didn't move to a different city when I was younger, today for me it was like moving to Mexico City was like the biggest thing that I could achieve. And now I am planning to move not to a different state, but also to another country. Yes, it changed a lot my mindset. And in the university I met a lot of friends that have like this mindset, and yes, I love this moving to Mexico City and to be an out-of-state student. It was I learned so much. So
Yes, actually, what you say about the mindset, I agree really a lot with you, because I don't know if you haven't studied here at UAEMéx your career or something, your master degree, I think.
No, I have not.
Well, he's applying for the master degree in Harvard.
Okay.
Yes, I am applying.
Yeah, we studied the basic medicine career here. Well, not here.
Yes, I finished my MD in 2023.
What was that? MD?
Sorry guys. It's an MD is the medical degree.
Oh, I thought it was master degree.
No.
I get
No,
it.
sorry guys.
Yeah.
For this.
Okay.
When I finished my master degree, it's the MPH Master in Public Health and will be in like 2 years if I have a lucky. But yes, I finished my MD, my medical degree in 2023, and now I am in this part of studying and applying for my specialty.
Yes, it is.
Yes.
Okay, very good. Oh yeah, but
I
like
think you were asking like why did you study in Mexico City instead of
Here at Toluca. Okay, because in karate I met my best friend. His name is Yael, and he is like 2 years older than me. So when I was in my first year of high school, he was applying for the universities. And I remember that I asked him like, hey, what universities are you going? And he told me that I am applying to the IPN. What is this? What the fuck is that? And he told me that this is Instituto Politécnico Nacional and it's in Mexico City, and he need to move to a different city. And I said, why you don't study here? And he told me that some specific reason that I don't remember. Yes, but my plan was like, oh, you are my best friend. I want to move with you because we are going to be roomies and
so you study at the IPN?
Yes, at IPN, yes, Instituto Politécnico Nacional.
My father also studied there.
Yes?
Yeah.
Okay, from what school? Because in IPN there are 3 schools of medicine.
I don't remember because I don't remember at all. It was like let me ask you.
Yes, don't worry. Maybe the Escuela Superior de Medicina. It's the most common.
Maybe.
O la de homeopatía.
He told me. Yeah, he told there at homeopathic.
Okay, perfect.
Yeah,
I know.
I also have a question, and what is your favorite branch of medicine?
My favorite branch. This has changed a lot because before I have like one answer and then I have another. Before, my favorite branch was like physiology, cardiology, physiology of cardiovascular.
Cardiology is like for the heart, right?
For the heart and large blood vessels. So you need to see like, and I really like this part of hemodynamics. Because the blood function like as a fluid, and the dynamics of fluid, it's like physics. So you need to apply the concept of physics, like for example resistance, pressure, change of pressure and blood flow. And I really like this part combined of applying this law, physics law, to the body, to the blood. Yes, and I really like this part. And now I am really interested in research.
Yeah.
really interested in research, and this passion for research increased last year when I took this PPCR course from Harvard. And now I want to continue this pathway of becoming a physician scientist. So to give a consultation, to operate, but also to produce new evidence, to research. Yes.
So you also want to focus on the research, right?
Yes. Both parts. And the good part of the United States is that most of the physicians do this part. They do the research. And here in Mexico, it's very difficult to do both of this part because we don't have this mindset of the importance of research. So for example, when I was studying medicine, there were not like this engagement on this research part. You need to search for your own opportunities.
And if you become a medical researcher, would that mean that you look specifically for things in the heart or in the bladder, like a specific body part, or is it general research?
This part of the cardiovascular physiology, I really liked it when I was studying, for example. But now, as I am applying for the general surgery residency, so I need to operate like the abdomen, the gallbladder, the bladder, the liver, the pancreas. So the research part will be like, for example, how to improve outcomes in a specific surgical procedure, in order to patient get better. So, for example, you need to perform this surgery in like whenever it's possible, in order to the patient to decrease the probabilities to the patient to get infections, or for example to get worse. So this part. So this is research. It's not like I'm going to operate like this. Now you need to follow some rules that are studied, and because the patient, you know that if you follow this guideline, the patient will be good.
Yeah, there's a specific method with
Yes.
the surgery, and also, well, there is so much stuff like the anesthesiologist, the surgeon, the nurse, and also the students. I don't remember how this word said, like the residents.
Residents,
The residents. Yeah, it's, well, at least what I've heard from my dad is that it's kind of difficult.
Yes.
But also interesting. I mean, at least in his case, he sometimes, well, when I talk with him, he says that sometimes he feels like a god because he has the life of the patient in his hands.
That sounds a little bit scary.
Yeah, it's scary. I mean, he's a good surgeon.
Okay, I hope so.
In all his career, there only have been like 2 people who, unfortunately, they died during the surgery or after the surgery, and he's been surgeon since the 1990s.
1990s, okay.
So there have been like 30 years,
30 years.
35 years.
35 years.
It would be so easy to be a serial killer as a surgeon.
I mean, in psychology, most of the murders and serial killers, they kinda into that stuff, like they're surgeons, most of them, or they're, well, also they have medical studies.
For a second, when Meli said that, I just instantly looked over to Jorge, and he was like,
I was scared.
Also the serial killers and all that stuff, most of them are surgeons, or they have studied medicine, or they're butchers, because like, well, you have to be so sane to have the ability to open a body and be so conscious that you have a life in your hands, and any mistake could cost the life or anything to the patient.
you have worked already in surgeries or something?
Yes.
Right.
Yes.
So you have had this feeling before, right?
Yes.
Yeah.
Yes, and yes, it's a very complex topic, because I think that for me, before you enter to medicine, I will suggest that you need to perform a psychology test, because I will suggest, because like as you probably said, there are a lot of people that have not like good intentions, and maybe these people like harm the patients, and also not only harm the patient, harm between us, because the medical is very like
Egocentric?
egocentric,
Right.
yes.
Yeah.
And it's like this fight of egos. I know I'm better than you, and and I'm not sharing this knowledge that I have to you, because I don't want to you grow much than me.
Very messed up.
Yeah.
Yes.
I think there are also a fight between the specialties
Yes.
in the medicine, like the neurosurgeons, the neurosurgeons, and also let me remember which one. The cardiologists, like which one is where, which one.
Yes, there are a lot of this kind of fight. I don't know. My specialty is better than yours, and it's not like that. It's like the final, the ultimate finally of medicine is to save lives and if I can save life of the people, I can acompañar su dolor. How do I say it?
Like grief under.
Yes.
Yeah, grief.
Yes, it is to stay with this patient,
Yeah.
the disease process.
You also need to be so
empathetic.
Yes.
Yeah,
Yes.
so empathetic to tell the family of the patient that he's
Suffering.
yeah,
Yes.
like the surgery went wrong and now the patient is there.
I
Yes.
think being a doctor is not only very hard in like the things that you have to study and that you have to like always stay on top of the new medical knowledge that gets discovered or whatever, but you also have to do a lot of emotional work to like actually be there for your patients.
Yes, of course. And for example, when you have some bad news, you need to communicate in a very good way to the family. Yes, and this is very, very difficult to do.
Have you done that?
Yes,
Oh.
when I was in my internado,
Okay.
my medical internship, it's 1 year. Whenever you finish your 5 years of school, you need to do 1 year of medical internship. And one day I had to give this bad news to a family patient, and it was very difficult for me. And I talked before with the resident, and he guided me. So how the approach to do that.
Okay, yeah, because you also have to learn that.
Yes,
of course.
you need because yes.
And
I-
what was
I
the
think-
situation? How did they react?
And because it was like a patient in the, I was in an emergency room, so in my night shift ward, and one patient arrived, and he was intoxicated with alcohol and some stuff like that.
Yeah.
He went to a party, and then
He was kind of high, right?
yes, he was high, and she had an accident.
Woman or man?
One man.
Okay, he had an accident.
He had an accident, yes. And then the families arrive, the family of him arrive and say like, hey, where's my son, or something like that. And unfortunately he lost his life,
No.
and then I need to
Give the notice to the family.
yes, to the family. And the resident gave me this instruction because because we need to learn these things,
Yes.
because we need to learn, and always we are in this learning process. And
As I know, it's also a challenge, no, from the doctors to the residents to tell the family that
yes,
that now the patient is dead.
yes, it's so the attending physician, the resident are the people responsible to these to
Of
give
the lab
this
or this
kind of information. So me as a medical intern, I cannot do that. A student, menos, o sea, un estudiante no. A student
Yes.
cannot do this, gave this information, but I had this permission of the attending physician that to give this
Yeah.
Why,
You do this.
why students are not allowed to do that?
Sorry?
Why students are not allowed?
Because you need to do with empathy. You need to do, and
To be empathic,
sometimes yes, you need to be empathic, and sometimes as a medical student, maybe you don't have this kind of sensitive,
Right.
being sensitive. So you need to learn this in the process. And whenever you are in your medical internship, you are more like this kind of freedom.
Okay.
But you need to also take this permission, to ask for this permission.
And so, like, do you think it would have been nice to like have a signature at school that teach you that, or maybe? I don't
Yes,
know, like,
yes, and yes, it's very nice. And I am remembering if I had a course like a signature about that, but I think that I didn't.
You didn't?
Yes,
Oh.
but this is a nice suggestion.
Okay.
So that would you say that is the hardest part about the job?
Yes, this is the hardest part to be like this is a very emotional part of the career.
Yeah, that's why most of the people can't study this kind of medicine.
Okay, so
I can't study medicine because I cannot see blood very well.
You can't?
No. No, I cannot. I don't faint, but it makes me very uncomfortable.
So have you been in a situation where you have seen blood?
Oh yeah, I mean obviously.
That's we should discover that.
Tell us your story.
Actually,
Yeah.
for example, a kind of funny story was when I was in high school. I was just with my mom at home right before I was supposed to go to school, and my mom was cutting something in the kitchen, and well, she cut herself, and she was yelling to me, "Cora, come help me, please! I need your help to put a band-aid on it." And I was like, "Okay, I'm coming." I came in with the band-aid, expecting like a tiny little paper cut or something,
Right.
and her entire hand was so bloody. She was dripping everywhere, and I was like, "Oh my god, okay." I could not look at her hand, so I was just like putting my hands out, with my face turned away, and I was like, "Okay, come here, I can do it." And my mom was like, "Girl, this is really not a big deal." She was so calm during the entire thing, but I was like, oh my god, you're gonna die." And she was like, "Just leave, I can do it." So I was a very bad daughter that morning because I left my mom do it by herself. Because I was very useless in the situation. But yeah, I also hate needles.
Okay.
Cannot stand when I have to get like injections. Ugh. No. And you? Why are you not studying medicine?
Oh, that the never passed by.
No, I don't think I like medicine at all. Like,
For you.
yeah, for me, obviously, right? Because I was not interested in like I don't have a problem with blood or something, but I don't know. It's just not like my thing, I guess. I think I'm more into like coding, programming, or creating in general. Yeah. Like yes. Mhm.
Yeah. Fair enough. I have another medical question.
Okay.
And that would be that I'm very interested in knowing or in learning about how like it works with psychosomatic things. You know what I mean? Like when you think that you have something or that you have like very strong emotions about something and it actually has consequences for your body, for your physical health.
Yes. Yeah, this is a psychiatric term, somatization.
Mm-hmm.
So the somatization is when you feel that your body hurts, some part of your body hurts. But for example, I have like a abdominal pain, a very hard. It's very hard, and you go to emergency room, and they perform an ultrasonography for maybe investigating the liver, the gallbladder, like a stone that stone in the gallbladder that is
A kidney stone, I think. A kidney stone?
Also, a kidney stone can be
it's something different.
No, it's something different, but
Okay.
related. For example, a gallbladder stone is in the liver, in the gallbladder, and a kidney stone can produce also an abdominal pain, and also other things like, for example, appendicitis, diverticulitis, and they perform every study, and you are fine, and you cannot explain this pain. So this is tú estás somatizando. I don't know in English how do I say it?
I think it is somatis.
You are somatizing.
You're psychosomatic.
Somatic.
Yes.
More like
You
somatic.
are.
Like you feel a ghost pain, like
Yes, exactly. I sound like a ghost pain,
Oh.
and this comes from the mind. It's a psychiatric. Yes.
And how is this possible? Is what I'm curious about.
Because I don't know. But the only thing that I know is it's a psychiatric term, and psychiatrics are the people that try to minimize this pain, maybe like giving some medications. And the curiosity of this is like, for example, if you gave this patient a placebo is like a pill that has no effect, but they feel like they are improving their pain, so they are like, oh yes, this medication is very good, and
like
this
you give them a painkiller specific for that imaginary pain that they have.
Yes, exactly. So you are combating this ghost pain with a ghost medication. It's a placebo, and sometimes they are performing well in the examination, and it's like curiosity. It's a very interesting question. This like more a psychiatrist.
Okay.
Maybe we can invite a psychiatrist.
Okay. Do you have any questions that you've been wondering your entire lives about medicine, bodies, or anything? Because I have asked him already a lot of mine when we had our last class.
In my case, no, because I'm really used to these kind of conversations with my class.
Fair enough.
Yeah, like we talk. Well, when I was young, all the house were full of medicine books and also medic stuff like injections.
Yes.
Let me remember, mysteries and all that stuff about hospitals, and the most common topic we have my father about medicine, and also he's the reason why I like the series Doctor House.
Do you like Doctor House?
I don't watch series. The only series that I watch is The Last of Us. But in general, I don't watch a lot of series. I think like
You prefer reading?
no.
I'm guessing you just
you don't have enough time.
For example, video games. I can play video games, but series, I don't watch a lot. Maybe like three series in all my life.
Crazy.
Yes.
You don't have enough time, right?
No, it's not about the
You don't
time,
really-
but
you don't like
maybe when I'm looking for a series or a movie, I start to look again, and it can pass like 30 minutes, an hour, and I do other thing because I don't encontrar.
Fine.
I don't find any good series that I get.
Okay.
Yes.
Yeah, that's okay.
And so we were talking like before. So you wouldn't study medicine again, or you would?
No.
This is a very tricky question, and I didn't regret about my decision, but
Yes.
now I am become more self-aware that medicine has to do with very sacrificial. How do I say sacrifice career.
Yeah. Sacrificial? Maybe?
Sacrificial, yes. And for example, I told you previously that I also really like computers.
Yes.
I also really like to. I want to learn how to program in Python. I would like to learn how.
It's funny.
So, for example, this kind of things that you know and you probably do very well. I would like to have these abilities, to this knowledge of programming a new thing, to coding. I really like computers. I really like to know the hardware, the software, and I really like Apple because Apple has this hardware and software. Like they know how to do these things very smart, and you don't have to spend a lot of time to know how it functions. So, for example, if I had the opportunity to choose a game, maybe I could go to medical bioengineering.
Okay.
Because I think that it combines with this part of that I like also, the programming and medicine, because I really like medicine. And I didn't regret of my decision. I really like this part of medicine, but it's a very sacrificial career. Yes.
Mm-hmm.
Yeah. Yes, but the final answer, no. I still stay in medicine. I really like
He likes
it.
playing golf.
Yeah, no, not like playing golf, but yes, I really like.
Very inspiring.
Indeed.
Last class I also asked him if he was able to like walk around and diagnose people sometimes just from looking at them. And I found the answer also very interesting. If you would like to repeat that.
Yes, I said to Cora that sometimes some diseases you can like get like an insight that maybe this patient is suffering of this. Of this because of physical examination, and in medical internship and social service, and when the more you practice, the more your eye become like an expert. But you don't rely only on the physical examination. You need to perform laboratories. You need to perform radiographs, ultrasound, tomographies, resonance. But some disease, and I say Cora and explain, for example, a liver disease, for example, hepatitis. Whenever you get infected with this hepatitis virus, for example, your skin gets yellow. Yes, and the first thing is like the sclera. The sclera is the white part of the eyes. Gets like yellow. And if you see somebody around with this yellowing of the skin, the sclera, and he's fatigued and he's like suffering about like anorexic. He cannot ingest like certain food. He's fatigued and he's yellow of his skin. Maybe you think of hepatitis or some liver disease. But you need to perform an examination. For example, you need to do a comprehensive metabolic panel. And some stuff like that. Study blood.
A blood test?
Blood test.
Okay.
Yes. So
You wouldn't recommend to like self-diagnose myself with ChatGPT?
No. I love that.
Like,
I love the
I
question.
have a headache and I don't know.
Yeah, like Google, you have cancer. Nolan, you're pregnant.
Oh
oh no. No, absolutely no. ChatGPT is a very, very good tool, but for auto-diagnosing, no, it's the worst use of ChatGPT.
Yeah, because there are cases like I feel pain in my eye. Now I have cancer.
Yes. This is a very extreme example, but no,
It happens.
You don't have to use ChatGPT for this purpose because more and more people have like doing this, and I think that this can have very bad consequences because people are like automedicarse and taking pills that maybe they don't need, and maybe they are hurting their liver because the liver is where these pills get metabolized.
The med stuff.
Yes. So no, ChatGPT is a very, very good tool, and I think that this is the future. The
Not yet for this scenario.
but not yet for this scenario. So, for example, in medicine, I think that nowadays it's like being more implemented. For example, to help and aid the medical diagnosis. For example, when you take the physician take a plain radiograph of your abdomen or a tomography, the intelligence artificial recognize some structures.
Okay.
And they help to aid in a diagnosis.
Okay.
But the final diagnosis is from the human part, from the doctor. Yes. Yes. And I really like the artificial intelligence, because this is going to be seen more and more in the medical practice. And I am very excited in 5 years how the medical advancements will be.
Yeah.
Awesome.
Awesome.
Yeah. Awesome. Okay. Is there anything else that you would like to say?
Yes, I have a question about Germany.
Okay.
Because you come from Germany. And I want to ask you, how is the medicine in Germany, and if you can tell me the difference if you have been in contact, maybe with me, maybe with another doctor, maybe in the consultation that you have been because you were sick or something like that. How is the medical part in Germany and here in Mexico?
I think it is pretty similar. I think only one difference I have noticed is that in Germany, when you go to the doctor, when you have a cold or whatever, they usually don't, the first thing they do is not prescribe you medicine when you have like something normal. They say drink a lot of tea, stay at home, rest, and also my doctor always told me to eat onions with honey. My doctor told me that, like, every single time I had a cold, but I never did it because I'm a picky eater, and I was like, no quiero. But my sister and my mom always did it, and it actually like really helps, I think. So they actually ask you to be more natural before they let you take medicine, or they tell you to take medicine. And here I was sick like a few weeks ago. And I went to the doctor, and he said that I had like maybe a parasite, and he gave me like antibiotics that I bought. I personally, I didn't really feel like I had to do this, like I had to take that. So I didn't. And I got better like after like a few days.
Without the antibiotics?
Yeah, I didn't take any medicine.
Okay.
Well, I took one, which was like anti-parasite, but that was like one-time pastilla. But I didn't take the medicine, and I got better. And I was still wondering if I like should have taken the medicine, or if he might have like misdiagnosed me or something. I don't know what it was, but because I didn't feel in my body like I had to take medicine, like at least not antibiotics, and it was okay. So maybe that was the only difference that I noticed, that in Germany they ask you to be more natural at first.
Okay, and for example, the difference in the public sector and private. How is the private sector in Germany? Or it's more like homogeneous, so for example, the same public system for all the citizens?
It's a mix. So there are private hospitals, but there's also public hospitals, and a lot more public hospitals than private hospitals. And well, I've never been to a private hospital really, but I mean, I've always gotten really good healthcare, also free healthcare. As well, at least except for when I had to get braces, but we also got some money back from that.
So this is free. The braces are free.
Not entirely. It depends on what your teeth look like.
Okay.
Like if you actually
Like
need
the kind
it.
of problem you have in your teeth.
Yeah, if it's harder, if it's like a bigger problem, then yes, they pay full. But if it's just a little bit, I just had a little bit. They didn't want to pay, but I got like a doctor who made it possible. Like I don't know what he did. I was like 12, so I don't know.
Yeah, remember.
But yeah, I think I don't know exactly how the private sector is in Germany, to be honest. But I think it's more the waiting time that changes, not the service itself.
Okay, thank you very much.
Yeah, you're welcome. Anything else anyone wants to add, ask, or doubt?
I'm good.
Okay, perfect. Well then, thank you so much for being here today. Even though you're sick and you're just coming from Mexico City from your work, it's really appreciated. Thank you so much. I really enjoy listening to this medical expertise.
Yes.
It's very interesting.
Yes, it was an interesting conversation.
So yeah, thank you so much.
Thank you guys for having me, and thank you for all your questions, and a special thanks for Cora that helped me a lot with this scholarship process. And yes, this is the reason why I am here. I'm happy to be here and to collaborate with you in your podcast. And if anything you have, anything you need, you can contact me.
That's so nice. Thank you.
Bye.
Yeah. Thank you so much. Adios.
Bye.